We have patients come into our office that come in reporting pains into their neck, their mid-back, their upper back. These are pains they've had chronically. Usually these patients are coming in, they're typically older than 50, and they've had these pains for many years. They'll come in reporting that their pains are worse when they're sitting for long periods of time, when they go to get up or change position after being in one position for a long time. Oftentimes these pains are worse while sitting and driving or while working on chores around the house. We go through and do a physical exam, and we find that a lot of their pains are worse when they're extending their spine. So when we see these things, we go through and we do x-rays, and we find that as we do x-rays, we see in their spine signs of arthritis. We often see signs of arthritis, and particularly into something called the facet joints. With the arthritis that we see, we can then go through and do a diagnostic test where we go in and inject a local anesthetic around these joints and test out how much of their pain is coming from that source. Oftentimes patients will report significant relief into the area, and as they report significant relief, we can go back through and do a procedure called the radiofrequency ablation to go in and ablate the nerves that are connected to those arthritic joints.